Welcome to Voices of Ivan, a podcast where stories of strength, survival, and science come together. We are here with one of the leading neurosurgeons in India, Dr. Laxminadh, with over 18 years of experience in his field. We're here to break down the emotional and medical journey of brain tumors. In India, over 30,000 cases of brain tumors occur every year, with 20% of them being children. Doctor, let's start. Can you tell me more about what brain tumors are and the different types of brain tumors?
First of all, what we have to understand, general public, what I want to tell you, there are two kinds of brain tumors. They are benign tumors, they are malignant. So 80% maybe safe. Most of the tumors what we see, what we come across, mostly they may be benign. So when you hear the term brain tumor, don't get scared of that. It has some benign components also. So, and we don't know who will going to get, how they are going to get, except 10% who run through the some very rare genetic causes like neurofibromatosis. Most of the tumors are there sporadic, they can come to anyone. So we can't generalize, but we have to understand benign component, it has malignant component. That's the one thing I want to tell. And in benign component, there are some kind of tumors like meningiomas. They are epidermoid tumors, or colloid cyst, or dermoid tumors, arachnoid cyst. They are benign in nature. So some tumors or some cysts, depending on their size, location, some may need surgical treatment, some may not need surgical treatment. Most of the tumors, sometimes this cyst, we just keep in follow up, so they may not increase in size. So no need to intervene there. Just we have to follow clinically, and we will follow radiologically, imaging wise, yearly once, or maybe once in a 2 3 years we'll do follow up MRIs, and we see the size or growth of the tumor.
Can you share some early stage of detection of brain tumors, some symptoms of brain tumors in the early stage?
Early stage detection, mostly it is a clinical suspicion. So when our patient, or when the one person has a new onset or first time having seizures or severe headache. It may be, see, headache is a very generalized symptom, it comes to everyone. But when he has atypical character, so whatever we are experienced the headache previously, it may not be in that character, it may be more severe, more it is coming more often, more frequent. It is severe and it is not reducing with rest or some kind of painkiller. So at that time, or seizures, or some kind of neurological deficits or complication like weakness or slurred speech problem, or weakness in the hands, legs. Sometimes they may lose consciousness, blackouts. So these kind of weird symptoms or changes in our behavior. Some people have behavioral symptoms, some kind of tumors, some kind of areas like frontal lobe, we call frontal lobe. They give behavioral symptoms. Some people suddenly they lose memory, memory loss, speech problem, behavior. They will get more aggressive, or more they become more dull. They become almost non responding to calls, or they are not paying attention to the surroundings. So whatever the changes in the behavior, we have to notice, and we have to think about that, and should not rule out or should not say it's normal. Make sure that we should approach the doctor, and the line of treatment or line of investigation should follow as early as possible. So nowadays this MRI and CT scan is available, so we can, MRI is radiation effect. So MRI is safe, except for who is pregnant ladies are carrying. Otherwise, for kids or for elders, it is reasonable. It is safe. So you can get MRI and it will detect the tumors, anything in the brain.
Another question that's very common: can brain tumors be prevented? Is there a possible cause of brain tumors?
This is very tricky because we haven't get that point of what is exact the reason or cause for brain tumor and how to prevent it. mostly this research will go on, and maybe few years, after few years we may come to know how to prevent that.
Exactly. So, over the years, the treatment of brain tumors have changed drastically. Can you pinpoint how the treatment is right now and the future advancements in the treatment of brain tumor?
One thing is, while treatment in the sense, first how do you diagnose? Definitely MRI plays very important role. Nowadays we have uh, very novel techniques in the MRI. We can see which is benign tumor, which is malignant, which area it is located, how it is going to function. The brain has function, it will function. So how it going to affect the function of a human being patient, so we can do that. And treatment wise, that's the one is diagnosis, rest, surgical treatment or medical treatment. When you go to most of the brain tumors, they require surgery. So as a neurosurgeon, every year we are improving our techniques, we are adopting new technology, like I use neuronavigation. So neuronavigation help during the tumor to locate, to exactly locate where is the tumor. So I can just target the tumor and come out. I need not to disturb the rest of the normal brain. And we use high-end microscope. Microscope helps in visualizing the structures. So neuronavigation, that is locate, microscope after locating, while we are encountering, while we are dealing with the tumor, we won't disturb the normal brain. So we will just we operate only on the tumor part. While operating, we use microscope so that we won't disturb the normal brain. And visualizing the arteries, vessels, complicated, while we are dealing with complicated areas, we can safely deal with those structures. So it will prevent the bleeding, it will prevent the post-op deficits. Then after the surgery, during the surgery, brain tumors, we use fluorescein and dye. We are using dye to demarcate brain tumor from the normal brain. And nowadays I do regularly some kind awake craniectomy, awake surgery. So some tumors which are in the eloquent cortex, eloquent areas like speech or weakness, power or muscle movement in the hands and legs. During the surgery itself, we can monitor how the patient is speaking while operating, how the patient is moving his hand or legs. So it is called awake surgeries, awake brain tumor surgeries. We do that regularly. These are all the new technologies, whatever we are adopting, evolving. And after the surgery, we send for pathology. They do molecular marking. They stage the tumor, first characterize the tumor, then they stage the tumor, then we have molecular markers. With molecular markers, we have some targeted therapies. So some tumors, they are very responsive, some kind of chemotherapy or radiation therapy. So we can use those therapies or those targeted tablets or therapies to prevent recurrence or to prevent what you say, further growth. So they are the new technology evolving in brain tumor.
Is there any integration of AI in brain tumor surgery or detection?
Yes, AI has its own role in detection, in the correlating with MRI findings to get the nearby or near diagnosis in the MRI findings based on MRI characters with the different sequences. Then we can use AI in mainly in the neuronavigation part. It helps a lot. So we can club that neuronavigation with the AA. And again, it will help in the treatment part also, like molecular markers with a different kind of tumors, with different of molecular markers. Definitely, there is a very good role of AA.
Can you tell me where India stands on global standards? So, recently, India has become a healthcare tourist destination for a lot of different countries. A lot of people from different countries come to India for their treatment. So, over the years, how has India improved and where does it stand on a global level?
Nowadays whatever we are doing as per international standard protocols, and most of the institutes they are equipped with latest technology. As I said, some doing endoscopic surgery, some do microscopic surgery, some do 3D printing. So it is not that we are not able to do one case or not able to operate, not like that. Or in the we are, as far as the Indian neurosurgery concerned, it is as good as in international level or global standards. We can deal with most of the tumor, almost all the tumors, in a better way.
And it's cheaper
Compared to it is financially it is better.
I have another question regarding post diagnosis, post surgery process, the rehab process for a patient. How is that determined? How should a patient go about with it? Is it the same for every patient? Does it differ based on the type of tumor?
Yes, yes, it definitely different from depends on type of the tumor, then recurrence or first time surgery or age. And some tumors when it will affect the electronic cortex like motor power, so they need more intensive rehabilitation. Some people non-eloquent areas, there are some tumors very, meaning temporal pole, we say pole meaning it's the end of the frontal pole, temporal pole, they may not affect the brain function, so they may not require rehab. But when our brain function, our function of the limbs, hands, legs, speech is getting affected, definitely they need more extensive rehabilitation.
Alright, so like physiotherapy.
Yes, it should definitely, it will help in the recovery phase or rehabilitation phase. They will recover most of the functions back.
Coming to the emotional aspect of brain tumor, can you pinpoint how a case of yours was special to you? How a particular patient inspired you through their attitude, through their perspective towards treatment, and how it's important to have a positive attitude, a positive mindset to improve the recovery process?
He underwent second surgery, first surgery 10 years back in Mumbai. Then I have seen her with the seizures, and MRI done, it showed recurrence and we have to operate. It's a second surgery for her. Then underwent radiation and chemotherapy. Definitely whatever I see, that one particular, whatever you ask me, particular patient who inspires, because whenever someone underwent second surgery, uh, she didn't feel, at least psychologically, emotionally, it is like a setback. She took as it's a challenge, and she faced that challenge or difficult period with 100% confidence, and not only face, and she knows how to deal with that and occupying herself both psychologically, mentally, and some kind of work. So yeah, we should not it should not affect our emotional thing. We have to just overcome that. Yeah, what I can say, it's whatever the brain tumor or the treatment, it is not the end, it is a temporary stop. That's what I want to tell everyone. It is a temporary halt, and our journey will go on. Yes, that's what I want to tell. And yeah, we will recover with good rehabilitation and intense physiotherapy with more. It is a positiveness. As how much we are positive, our recovery will be fast, and it will be in the 100% scale.
Exactly. That's well said. And that's what everyone should follow, a sense of hope and a positive mindset, and you can fight every
Yes,
battle that
yes,
comes your way.
exactly. We have to fight and combine with the medical knowledge with our ongoing struggles, because when our medical knowledge or technology is evolving, whatever we are facing the difficulties, are facing the problem. So there are high chances of to overcome with that. So this technology should help us to overcome our struggles and to come to the normal life, bring to normal life.
Can you emphasize on how a community of patients that have been through similar diseases, similar cases, how can a community like this encourage other patients to do better, to get the right treatment?
Because first we have to be courageous enough to just accept that, and we should also think that it is not the end point. And we have very good facilities here nearby. It is widespread. It's a neurosurgery or brain dealing with the brain tumor. It is not just one area, metro areas. Of course, we have better facilities in metro cities, tier one, tier two cities. But emotional aspect is we have to just approach the doctors and get the treatment as early as possible, and take little bit of rest, come out of from the routine, give time for the body to recover, and just focus few days or few months on during the treatment on our health, on our mind, food, mainly diet, good amount of diet, some kind of meditation to strengthen our psychological or emotional strength. So give time to recover, and yeah, like a community or family members should support that recovery phase. So as a combined support or help, so these kind of brain tumor patients, they can be very good survivors.
Yes, be fighters.
Yes, yes.
To wind up, I have a list of myths that are around brain tumors. Can you quickly just tell us if that's true or if that's false? And
Yes, yes.
so let's start with brain tumor means brain cancer.
It's a myth.
Yes.
It's not. All the tumors are not cancers. Most of them are benign, so it's not synonymous.
Can the brain tumor spread to other parts of the body?
Brain tumors spread. No, it's also a myth. Other tumors, they can spread to the brain, like a CA breast, CA cervix, or CA lung. These are called malignant tumors. They will spread from other part of the body to the brain. But generally, primary brain tumor spreading outside, except some kind of very rare melanoma.
Okay.
Other 99% rare.
Very rare. How does mobile phone and radiation exposure in the workplace
It
or
is a kind of controversial.
okay.
Now, till date, we don't have any supporting robust data to say radiation or cell phone is causing brain tumor. So I can say it's also myth, but we should limit usage.
Yes. All right. Thank you so much, doctor, for
Thank
your
you.
time.
Thank you.
Thank you for telling us everything related to brain tumors and clearing a lot of confusion out there. This was very helpful for a lot of people. Thank you so much, doctor. Thank you for
Thank
your
you
time.
for your initiation.
Thank you.